Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Ryan Oglesby, who is the president of the Emergency Nurses Association, or the ENA, about the ENA's new Emergency Nursing Triage Education Program. So, hi, Ryan, how are you?
Great. How are you?
I'm doing well. Thanks for taking the time to be here. This is a super important topic, so I'm excited to get into it with you today.
Yes,
So
thank you.
right
I'm
off,
excited to be here as well.
of course, yeah. So right off the bat, can you tell me a little bit about what impact having an inaccurate or inefficient nurse triage can have on the emergency department?
Yeah, absolutely. That's a great question. And, research shows that inaccurate triage decisions and actions that are made as related to those decisions can certainly cause delays in medical care, increased mortality risk, certainly longer length of stays within the ED and within the hospital, and also increase in complications when things go unrecognized. So, standardized triage education, along with well executed triage process, is really essential to prioritizing care and optimizing care in the emergency department and throughput.
hmm Absolutely. So, we're going to talk a little bit about the Emergency Nurse Triage Education Program, or the ENTEP. So, what was the inspiration behind the program?
Yeah, absolutely. The inspiration behind the emergency nursing triage education program was really a lot of that research and that feedback that came from our members as it relates to the difficulties and challenges they were having with triage and ED throughput. And so, a work group consisting of ENA members and staff to support triage education was brought together, and to create then a way of verification of triage competency and process as a way to address significant knowledge gaps that existed out there. And from there, that work began to evaluate the best approach in developing triage competencies, formalizing and executing on some of that research that we talked about earlier, and then putting together a standardized triage program, which is now INTEP.
hmm Absolutely. So, what does the program cover in terms of, like educational topics, and what kind of sets it apart from other training programs?
Great. Yeah, absolutely. In terms of what sets us apart is really some of that blended online and live classroom education, which really there's nothing really out there that's as comprehensive as INTEP as far as that goes, and is evidence based. And it's the only evidence based triage verification program that's available. So not only do we provide the comprehensive education program, but also a verification of those competencies at the conclusion of the course. And it really addresses the challenges of triage and promoting a safe space for dialogue and learning around some of that evidence-based practice. The key topics that are included in NTEP are critical thinking and decision making, the emergency severity index and the related documentation for that,
hmm
effective communication, and then also many triage scenarios that again give it that real life kind of learning module, learning component. And then also as part of that, we cover all um, age populations, including the older adult, pediatric, as well as specialty populations related to OB and other things that we see in the emergency nursing specialty. So that really sets the program apart as well.
hmm Absolutely. And just out of curiosity, what do you kind of think are some of the biggest hurdles that are facing ED nurses right now?
Certainly, the big hurdles in ED nursing right now are, again, really having that access to strong evidence based research and education to improve outcomes in patient care and improve throughput is a big part of it. Certainly, emergency department crowding is significant as it relates to triage competency and education and allowing us to provide safe quality care in the emergency department that's efficient and timely. And there are many other environmental factors in the emergency department. We're big proponents of a healthy work environment, including safety from violence and other things in the emergency department, but also a healthy work environment as it relates to leadership support and the ability for emergency nurses to have the resources that they need when they're providing care.
Hmm. Absolutely. So, how do you think CNOs and other nurse leaders can really help foster confidence in nurses' clinical decision making in the ED? Because I'm sure that that's a big part of the stress is learning in that fast-paced environment.
Absolutely, it is, and learning so much so quickly. You're exactly right. I think CNOs and other nurse leaders can help by encouraging nurse led initiatives, including nurses in policy creation and policy revision, as well as allowing them to invest in their own education and certifications, verifications such as this one. I think, again, comprehensive ED specific orientation programs as it relates to the core competencies that emergency nurses need, and providing new nurses as well as experienced nurses the knowledge and skills and kind of practical expertise that they need in this fast-paced emergency department environment. As well, with that comes along strong preceptor programs that allow for mentorship and guidance during those critical early experiences in the emergency department. I think CNOs can also help with ongoing education and training focused on critical thinking, clinical decision making and judgment, advanced assessment skills, and those kind of things. And then lastly, creating that kind of shared governance or shared leadership model where nurses have that voice, again, as we talked about in developing policies and protocols and how they practice in their daily work.
Hmm. Absolutely. And have you seen any positive outcomes from the program or nurse reactions that you'd like to share?
Absolutely, absolutely. We've heard lots of positive results and feedback from people that have been through the verification process. I've had a significant number of people already verified, as well as a large and growing instructor pool that continues to foster this program and the education. I had the opportunity to attend one of the sessions at the University of Miami here locally, and really great feedback from the people that were in that class and in that course. It was very positive and lots of new learning for especially even for those experienced nurses who had been doing triage for many years.
Hmm.
And a lot of that aha moment of, oh, I may have not been doing this um, as evidence based as I thought I might have been.
Mhm. Absolutely. Yeah, it's definitely a moment where you realize we're always still learning,
Right.
especially in
Exactly,
nursing.
100%.
Yeah.
Mhm.
Yeah. So, do you have any advice for CNOs who might want to implement a similar training program or who might want to partner with the ENA?
Absolutely. Yeah, we're always here to help our emergency nursing colleagues and our nurse leaders as well. And I think the initial step is really to start by evaluating the current triage process and see if there's gaps in consistency or documentation or clinical decision making. And then I think partnering with an association like ENA with an evidence based program like NTEP allows us to further evaluate triage practice across the department while also reinforcing the confidence of the nurses in their skills and abilities. I think
Mhm.
also additionally making space for structured training in the orientation to the emergency department, as well as ongoing education plans for continued competency are also important. And supporting nurses with time and resources to fully engage in those learning opportunities is key. Having that leadership buy-in from our chief nurses to our ED leaders to help champion triage education is really a signal of clinical excellence, and it really signifies that the quality care that we provide in our hospitals begins at the front door in the ED.
Mhm. Absolutely. Well, thank you so much, Ryan, for your time. I'm really grateful to have had this opportunity to hear your insights. And thank you so much
Absolutely.
to our audience for listening. Thank you, Ryan.
Yeah. Thank you so much. Happy to be here.